So first, what do we mean when we talk about a body-focused repetitive behavior, or a BFRB? So these are basically behaviors that are inflicted upon the body and can be quite impulsive in the sense of people doing them without really thinking, or actions that can be quite compulsive, where people are very aware that they're doing it, but feel that they can't stop doing it, almost in sort of a ritualistic kind of manner. It's often chronic in nature. So, and why we say that is because many of us can probably relate to maybe biting a nail here and there, or picking a scab, or things like that. But for body-focused repetitive behaviors, we're talking about these actions that are done over a consistent period of time, where it can be quite chronic, can often result in physical damage, and is something that can sometimes result in feelings of pleasure to individuals and pain, or both, as we'll talk about later in relation to ADHD. People who engage in BFRBs often want to stop the behavior, but feel that they can't. They feel very sort of sucked into the vortex of the behavior, and will always dislike the consequences. Now, examples of BFRBs can include trichotillomania, which is hair pulling, dermatillomania, which is skin picking. And skin picking can be everything from popping pimples, squeezing blackheads, but it can also be picking scabs. It could be just picking extra skin around the fingernails. It could be any sort of aspect of picking at skin. I've had patients sometimes pick at moles that are just these bumps on their arm that they get so distracted by, and are trying to almost pick them off. Nail biting, skin biting, and by skin biting, it could be things like biting the inside of your cheek. It could be sometimes like biting sort of parts, of your hand. Just the idea of having like the sensation of skin between your teeth, basically. Nose picking, as well as knuckle and joint cracking, are all some examples of body-focused repetitive behaviors.